So hi everybody, I'm Elaine from Cerebra's communications team, and I'm really happy today to be chatting with Lowri, who's a PhD student working on a joint project between Cerebra and Cardiff University. And the whole project is about mental health in children with rare genetic diagnoses. So hi Lowri, thanks for joining me.
No, thank you for having me back. It's been a while since time.
I think you're the first person I've chatted to twice. So
honoured.
So I know today, Lowri, you wanted to let people know about a new study that you're embarking on as part of the project, looking at children's school experiences and how that can impact their mental health.
Yeah.
And I guess, you know, school is such a huge part of our lives as we're growing up. There's lots of sort of potential there for it to have a big sort of effect on us. So I just wondered if you wanted to tell us a bit more about why you're doing the study, really.
Yeah, of course. Yeah, I guess, you know, like you said, school is a massive part of all of our lives. As you know, when we're growing up, we spend probably more of our waking hours in school than we do anywhere else, and you know, making friendships and the kind of academic learning side, it does have an impact on us later in life. We know that you know, previous research has been done that shows school experiences does have an impact on us, and you know, specifically I'm looking at mental health and the impact on mental health, and we know that kind of negative school experiences, for example like bullying, can negatively impact children's mental health whilst they're still in school, but also whilst they're, you know, as they grow up into adulthood as well. So we know that there's a link there. However, there hasn't been any kind of specific research done into this group of children. So children who have a genetic condition which put them at higher risk anyway, sort of genetic risk of neurodevelopmental conditions like ADHD and autism, and also for mental health conditions. So we really wanted to sort of investigate this, explore the kind of relationship between school experiences and children with rare conditions specifically, because they haven't really been looked at as a standalone group, and it's important.
I guess that children with these rare genetic conditions face a whole different set of challenges in school than groups of children. That's quite specific to them, really, I guess, in terms of perhaps a lack of understanding or a lack of the right sort of support. Would that be fair to say?
Yeah, because these conditions are very rare. It's hard for, you know, professionals and you know, staff in school to know exactly about all the different rare conditions and how they impact the child specifically. And I think sometimes what happens is people might hear of a condition, they're presented with a condition that they've never heard of before. They don't understand kind of what that means for the child then in terms of their support needs. And so that kind of general lack of awareness and understanding of what the child needs we hear from parents a lot of the time that schools might not understand their child's condition, and so sometimes they're left without some of the support that they need. So yeah, we just want to find out a bit more about that, really.
Okay, so how will you be doing the study? Is it a questionnaire? Is it, well, you tell me.
Yes, so we've got a questionnaire developed that's already been doing face-to-face with some families, but to get more people involved in the study and make it a bit more accessible, we've put that as an kind of transformed it into an online version as well. So there's an online survey that's ready to go that people can take part in. And then a bit later down the line, I'll be sort of interviewing people as well, so parents, teachers and children themselves, to find out a bit more kind of in detail what the challenges they have, and also, you know, the things that they like about school as well, because it's important, or the positive things too.
Yeah, that is important, isn't it? There's always a flip side of the coin, and there are positives as well as the negatives. So so who are you looking for to complete this survey?
So the online survey is for parents and main caregivers of children with a rare condition that's known to be associated with neurodevelopmental conditions. So again, that's conditions like ADHD, autism, intellectual disabilities, and we're looking for parents of children who are 15 years and younger. So if you're a parent and your child is 15 years or younger, you're very welcome to take part.
Brilliant. And it is for the rare genetic conditions.
Yeah.
Brilliant. And with this video, we'll make sure that we post a link to that survey so people can just click on it and find out a bit more. And I guess if anybody's got any questions, Lowri, they can drop you an email and ask for what they need.
Yeah, of course, an email or give me a call. So
we'll make sure we include that as well. And just like to encourage everybody really who's, fits in with the criteria you're looking for to fill it in and to help us to understand this link or possible link a bit more. I appreciate that this survey is part of a bigger piece of research, but what would be the end of it? What would you like this work to achieve?
So I guess the ultimate aim is we understand a bit more about, the specific experiences that children have, which then can maybe lead to them experiencing some problems with their mental health. We can put in place, we can help schools to make, I guess, schools a bit more of a positive environment for all children. So we can, help schools offer more positive experiences and, put in support the place that children need, and also kind of, advise, and with information leaflets, we can produce lots of information leaflets about this research, really get the message out there and really help schools to help children, really, I guess.
Oh, fantastic. Well, thank you for telling us all about it. And I hope to catch up with you again just to see how it's all going, and that would be good. But yeah, in the meantime, please, if you'd like to take part, then please do. Really, really appreciate your help.
Yes, definitely. Thank you in advance to anyone who does manage to take part. So yeah.
Oh, thank you, Lowri. You take care, and I'll catch up with you soon.
Yes, thank you, Elaine.
Bye.